Hi everyone, and sorry for this for being like 1 or 2 minutes late. Welcome to this IA2030 WHO and TechNet 21 webinar series on life course and integration. This is our 4th session, and today we will focus on opportunities for integrating COVID-19 vaccine with essential immunization services within primary healthcare. You can listen to this presentation in French. To do so, please select the globe at the bottom of the Zoom window and choose the desired language. If you struggle to find it, just let me know in the chat area. And while we're talking about the chat area, you can already introduce yourselves and tell us where you are from. And you can also tell us your name. We will be really happy to know who's with us today. You can also use the chat box if you need anything related to technical support. If you have problem with sound or anything, then it can help us to identify if there's any technical issue, and we can help as much as we can. If you have any question during the presentation, please use the Q&A box. It's available also at the bottom of the Zoom window. Ask your question at any time, and our panelists will answer them after the presentation during the Q&A session. So there's the presentation for like 30 minutes or so, and then there will be a question and answer session. Finally, this session is recorded, and that's actually why we started a bit late, because there was a little technical problem with that, but everything is fine. It's recorded, and we'll share with you the links to the video as well as to the slides by email. Thank you very much for joining us today, and we hope that you'll enjoy this session. I'll give the floor now to Laura. Laura, the floor is yours.
Thank you, Alex, and hello, everybody. A very warm welcome to the SP4 Life Course Integration webinar series. And today I'm Laura McLaughlin. I'm a technical officer in the Life Course and Integration team at WHO. And we're very happy to be joined today by Dr. Tingua, who's a program manager in the Immunization and Vaccine Development Program in Tanzania, and also by Rebecca Fields, who's a technical lead for immunization in the Momentum Routine Immunization Transformation Equity program as part of JSI Research and Training Institute. So today, we're going to discuss opportunities for integrating COVID-19 vaccine. And today I'm going to present a number of slides that come from the COVID-19 Vaccine Delivery Partnership. And this is a partnership that was launched in January 2022. And it is a partnership with UNICEF, WHO, and Gavi, the Vaccine Alliance, and it's supported by a broad network of partners. And the partnership works to try and accelerate vaccine coverage with a particular focus on countries with low COVID-19 vaccination coverage. So on the next slide, we're going to talk about, this is the outline of the talk today. So we're going to talk about what is the global status of COVID-19 vaccination, what is COVID-19 integration, why is COVID-19 integration important, and which support is available to countries for COVID-19 integration. Next slide. So I think it's important that if we just take a moment to reflect back to 3 years ago, there was no even discussion point about COVID-19 vaccination. Even if we think back to this time, 2021, there was no discussion around a COVID-19 vaccination. But by the end of 2021, and there were some supply constraints in that time currently, and this is the most recent figures we have available, 13.3 billion doses of COVID-19 vaccine have been administered globally, which is incredible. It's astonishing. It's something that we have never seen in our lifetime. And I think it's something that is really, really incredibly important that we recognize how much work everybody has done to try and ensure that we've been able to administer these vaccines. And of course, there's been a specific focus on specific risk groups or high priority groups. And those are health workers, older adults, and of course, people who are immunocompromised. So we see out of the 194 member states, we've seen huge advances, and where we see that upwards of 70% of populations have been protected against COVID-19 or have been administered at least one dose of COVID-19 vaccine. So in the next slide, we're just going to have just a quick look at kind of more in depth of what has happened in terms of delivery to to healthcare workers. And we see that 143 member states have reported at least one vaccine dose on healthcare workers. or at least 59% of healthcare workers are in the reporting of WHO member states of total healthcare workers in all WHO member states. So we're seeing that where data are available, we're seeing that countries are reaching these high-risk groups. There are, of course, opportunities for improvement, but overall, we're seeing that many countries are reporting that they're able to reach these target or these high-risk groups or these high-priority groups, and that the progress has been increasing and improving, month upon month, and these reporting were happening to WHO on a weekly basis, and we're seeing that with every report we're seeing that there's increasing numbers of these risk groups being targeted. And also in the next slide, this older adult coverage, and I think this is a very important topic, considering that we're talking about life course, that prior to COVID-19 vaccination, older adults were a population that were not really accessing vaccinations, apart from in some regions. But we see now that we have member states that are reporting that at least that are reporting vaccination amongst older adults. They're reporting that a high proportion of older adults have reached or have been reached with at least one dose of COVID-19 vaccination. And it's a huge feat. I think it's something that and we'll discuss it a bit further, but when we talk about life course and integration, the fact that we have these this group or this life course stage platform established now, where we have people receiving vaccines that weren't previously receiving vaccines, it could provide opportunity for further improvements and further access to other health interventions. So in the next slide. So what do we mean by COVID-19 integration? So in the next slide, I'm going to just briefly touch on what we mean by COVID-19 integration. And I'd like to kind of mention that when we talk about, how COVID-19 integration can be strengthened in primary healthcare, there was a guide launched just in February of this year, which kind of covered how you can, considerations to integrate or mainstream COVID-19 vaccination in primary healthcare or with other health services. And I think it's important that we, if countries are interested in understanding what they can do, that they use that as part of the guidance. And this is where this explanation or kind of definition of what we mean by COVID-19 integration is. And what we mean is that it's the partial or full adoption of COVID-19 vaccination into a national immunization program, primary healthcare and other relevant health services. And the overall aim is to improve program efficiency, sustainability, and enhance demand, and improving user satisfaction. And I think one of the main key things about life course integration, and of course as part of IA2030, is when we talk about improving user satisfaction, we're thinking about the people-centered approach, whereby when someone comes for when someone has a health contact, that when they receive that health intervention, that they have the opportunity to receive other health interventions. And this kind of builds on some of the key areas around the WHO health system building blocks, whereby when you want to consider how and what can be done with integration, that requires leadership and governance, it requires health system financing improvements, it involves increasing demand and community engagement, and of course we can improve service delivery, and then of course considering health workforce, and also what needs to be done in order to adapt health information systems. And then finally, access to essential medicines. And what we mean by that with immunization is that we ensure that we have quality vaccines available. So this is an area that I think a lot of countries have either advanced, and we're going to hear the example from Tanzania, but I think, the way in which we can think about how we can deliver COVID-19 vaccination now is really an important area. So in the next slide, we're kind of going to touch on to the point that, today countries are at different stages of COVID-19 integration. So we see that some countries have limited integration efforts, whereby they're mainly focused on accelerating COVID-19 vaccination delivery. So they're trying to do that in a more direct, vertical way. Other countries have planned integration in that they're trying to see about how they can transition COVID-19 vaccine delivery into routine immunization, primary healthcare, or other relevant health services, but they don't have an exact date in mind. So when we talk about planned integration, some countries may try to consider how they can deliver COVID-19 vaccination for particularly a certain group, such as older adults, when they have other health contacts, or create a package of services or try and do that for that specific age population so that they can receive multiple interventions during their health contact. Then we have countries who are doing opportunistic integration, whereby they try to have short-term ad hoc activities, where they try to drive out resource constraints without any clear strategy or plan in place. And then finally, we have countries looking at structured integration, whereby they have strategic activities that enable them to do systematic integration, where they can consider and plan out where they can reach target groups. And this can include cross-sector coordination with other primary healthcare partners. So in the next slide, we want to talk about why is COVID-19 integration important. So as you mentioned with previously, COVID-19 integration is highly relevant for primary healthcare and other non-immunization programs. So by having COVID-19 integration considerations, it can really help strengthen health system collaboration. What we mean by that is that when you try and integrate COVID-19 into primary healthcare and non-immunization programs, it really provides an opportunity to strengthen collaboration across primary healthcare stakeholders. As we know at the moment, primary healthcare can be quite vertical in that we have certain programs that have certain funding streams, or that we know that certain other programs maybe have more donor-driven mindsets, or trying to focus on delivering certain interventions in a certain way. But ultimately, the idea behind primary healthcare is that we work together and we consider the people-centered approach, whereby people are the user populations, or the user-centered approach, whereby those who are accessing our services receive a package of services, and we want to make sure that when they do access our health services, that those services are available. So by having a strong primary healthcare system, we're improving user satisfaction, but also we're enhancing the technical skills of our health workers also. Now we have some learnings that we can build upon from COVID-19 vaccination. And we see that with the rollout of COVID-19 vaccination, there have been incredible innovations that have been launched in the past 3 years. And really, it's been incredible from both a delivery aspect, but also from how countries are trying to also report and record vaccination. We see major advancements with digitalization of how countries are coming up with new ways of trying to record and report COVID-19 vaccination. But how can we leverage on these experiences and performances to try and adapt and improve primary healthcare? And then finally, there's an opportunity to benefit from priority funding for COVID-19. So at the moment, there are some dedicated funds available for COVID-19 integration, and we'll touch on that a little bit later. But just to say that, for certain countries that are eligible for these supports, that there is opportunity to benefit from this priority funding. Next slide. And also, this slide there's a lot going on here, but this is a slide that has been adapted from the guide that I mentioned. But by having COVID-19 integration, it also creates a platform for other upcoming life course vaccines. And highlighted in red here, we see that there are some the pipeline of new vaccines that are coming across a life course. And by strengthening and establishing these life course stages now, it can really benefit for the vaccines that are coming down the pipeline. Not only for other vaccines that are coming down the pipeline, but also other aspects of other health interventions. We can help strengthen how we can deliver and provide these during these contacts amongst these different life course stages. So we have pregnancy, newborn, infant, second year life, child, adolescent, adult, and older persons. And for COVID-19 vaccination, we have, as I mentioned, we have these high priority groups. And amongst those high priority groups, we're typically pregnant women, health workers, and older persons. We can think about ways in which we can try and strengthen these platforms going forward, think about other health interventions that can be delivered. And ultimately, this can lead to strengthening primary healthcare and increasing the people-centered approach and user satisfaction. Next slide. However, we have to be cognizant that COVID-19 integration will not be the same in every country, and it'll be different based on different factors. So sometimes the integration process can be easier in some countries than others, and that depends, of course, on the country context and the existing programs that are in place. It also depends on the target population and how the country defines that target population. Funding, of course, is a big concern to many countries, because trying to roll out these vaccines and establishing these platforms and engaging with other programs outside of immunization to deliver the program, to deliver COVID-19 is not going to be as simple as with other, because it's the first time actually in many countries that this approach will be taken. But also, not only that, it also relates to digital systems. If countries want to try and adapt some of their digital systems, that also requires quite a lot of investment. Also, other considerations will be the interconnectedness of service delivery across immunization areas and also the health governance landscape. So this is not an exhaustive list, so there are many other factors to consider, but just to say that one size did not fit all when it comes to integration, particularly COVID-19 integration. It will very much depend on what the priorities are for the country and the current infrastructure and setup of the health system within the country. Next slide. So we're going to talk here just briefly about which support is available to countries for COVID-19 vaccination. Next slide. So there are 4 types of support that are available, and these cover support materials, technical assistance, political advocacy, and funding. And today I'm just going to touch on the support materials very briefly because Rebecca is going to expand on this further. And when the slide deck are shared after this, it'll cover the other support that are available in terms of technical assistance, political advocacy, and funding. Next slide. So as part of the COVID-19 vaccine delivery partnership, a support package has been put together following the launch of the guide that I mentioned that was launched in February of this year. So the support package takes into account the considerations for integrating COVID-19 vaccine. And as part of that, there is an integration self-assessment tool. There is a readiness assessment checklist, which allows countries to identify what level of integration is actually occurring within the country. And then finally, there's implementation support documents. So it's quite a comprehensive support package that is in development at the moment and is being piloted in a number of countries. And I think that what's key is that that countries, if they require or want to try and request support, that they reach out to the relevant donors and partners within the country, and that we can try and assess what terms of readiness the country is with COVID-19 integration, and also what considerations they should take to advance that support. Next slide. So here we have, this is to reach the goal for COVID-19 integration. This is the guidance document that I mentioned. So this is the guide for considerations with integrating or mainstreaming COVID-19 vaccination into primary healthcare and other health services. So there's a stepwise approach that is mapped out in this guide, and that goes through initiating and building on integration, the planning aspect and developing a country integration plan, the implementation and monitoring, and finally post-integration follow-up actions. And as part of that, as I mentioned, there's an integration self-assessment tool. There's also a readiness assessment checklist. And finally, there's an implementation support document. And actually, Rebecca Fields, who's joining on the call today, is part of the team who's working on training materials for implementation at subnational level. And she will discuss that later on in this presentation. So I think with that, I'm going to pass on to our colleague, Dr. Tungwa, and thank you for your attention.
Thank you very much, Lola. Yes, thank you very much, Lola. I am Florian Tinuga from Tanzania, Ministry of Health, Immunization Program here. Together with me, I have my colleagues from the program and others from the technical working groups. So I'll be presenting on behalf of Tanzanian team. And then next slide. So I'll pass, we'll see briefly on the immunization status of our country, and then we'll look at the COVID-19, and then we'll look at the approaches for integration, then so far what we have done, and then we'll have the next lesson learned. Next. So Tanzania is found in East Africa, and it has almost 61 million people. As now, immunization program in our country was started late 70s, and the ERA it's almost immunizing 2 million children, but also, and during the COVID-19 implementation, we targeted to vaccinate 30.7 million people aged 18 plus years. We are not vaccinating below 18 years of age. Next. So as of April, out of the targets of 30.7 million people who was targeted to be vaccinated by COVID-19, we were able to vaccinate almost 53%, which is around 32 million, beyond the 32 million of above 18 years, but of 53.4 of total population, which is an increased threefold from March 2022, because in March 2022, we were still under the vaccination rate of 10%. So the value we see beyond 100% of 18 plus and 53%, it is the acceleration which was made after March 2022. And in our country, we have 5 vaccines which were passed by the mainland, but also we had the 6th vaccine, SUBNATION, which were being implemented in Zanzibar. So in total, these are the list of vaccines which have been implemented in our country, and Janssen being the leading vaccine to be used by our country beneficiaries. Next. Why did we think about COVID-19 vaccination? As I said, we invested much in COVID-19 vaccine, but due to that, we created a big challenge in routine immunization, where we left many of the kids unvaccinated. So in our analysis, almost more than half of the cancers did not achieve the routine immunization performance during the COVID-19 rollout. And this had increased the risk for vaccine-preventable disease outbreaks, in which we are seeing in different world countries, but also in our country, we are now experiencing measles outbreaks, but also sometimes we had rotavirus. So this is the reason we thought, in order to mitigate the ongoing outbreaks and prevent further, we have to integrate COVID-19 vaccine in routine program. Next. So now, how did we start approaching? The first thing our integration approach is from top down and bottom up, both. In the top down, we started by planning for integration by involving the technical working groups, donors, implementing partners, politicians, and the religious leaders. But also, after doing so, we are now developing a guideline, which now we are at the stage of developing a draft. And in the draft, we have considered majority of the contextual perspective, looking at what are the context of immunization perspective. And as you said, Lauren, in your presentation, among the things we are considering is the target. In our country, our policy is to vaccinate above 18. So this is taken in consideration during integration, but also we are identifying the target groups, the type of services and type of programs to integrate, because we understand, I will speak in the next slides, what are the services we are focusing in during integration, but also we are looking at the challenges which were seen during COVID-19 vaccination and what is seen during the routine immunization. Next. So, as I said, the integration approach was up and down and bottom up. In subnational level, even without having the formal guideline, based on the existence challenges at the national level, the first thing we were trying to engage the healthcare workers during the service delivery and during the supervision for them to include the COVID-19 and routine immunization. And this was done so because in order to maximize the resources which are there at the subnational level, which could, in one way or another, leave the routine immunization services and concentrate in COVID-19. So what we did integrate is vaccination services, distribution of vaccines. Now, this distribution of vaccines started from from the national level to district level. In our country, the national level distributes vaccine to the regional level, and the regions to the councils, and the council to the facilities. So we found it's very easier to take the vaccines from the district vaccination store together, the COVID-19 vaccines and the routine immunization vaccine to the health facilities. And there, because they are using the same code temperature, so they are being stored in the same refrigerators. But then, how are we doing that? We are using the same roof. I mean, if we are using the same vehicle for distribution, it's the same. If we are using the vehicle for outreach, so it's the same vehicle carrying health workers, vaccinating the routine vaccines and COVID-19 vaccines. And also they are at the same setup, but with the different locations of adults and children. Where do we integrate is, in most cases, we do use health facilities but also use outreaches, where outreaches and mobile services, where where healthcare workers moves a distance from the facility and takes the vaccines, where in the villages, in the communities where there is a need for the vaccines. But also in our country, we are using house to house. Now, house to house vaccination in integration is not easy. What is important, what we are doing here is demand creation using house to house by using community health workers. Next. Next. So, as I said, when we started integration, we did not start as complete plan. We started by selecting some regions where we had implementing partners and where the resources were available. And these regions were Arusha, Kagera, Morogoro, and we're using implementing partners from CDC, but others from USA. So these are some of the regions where we practice integration, and these are the numbers for the days they were doing. Now, we have used this best practice from these regions to generate the national guideline, which will be out as soon. We are planning the guideline to be out before the end of May. Next. So what have we learned from this integration? That integration is basically changes the mind of healthcare workers in the context that the little resources they have, it can generate a maximum achievements we need in the program at all levels. But also, by using the existing platform for service delivery, it also is a favorable environment for integration. But also the effective integration can be done by using joint planning, by involving technical working group, which includes implementing partners and donors together with the government. Next. So, but I said, again, developing of integrated monitoring tool that captures a performance for integrated services is crucial to monitor whether the integration is being effective or not. And all these we have included them into our guideline, but also creating vaccination teams and outlining the roles and responsibilities is the key, because we know during the COVID vaccination, the vaccination team, their target was vaccinating adults, and the routine immunization targets and the under fives. Now, during integration, we have to join the two and give them the roles, and in the end, they give the desired success during the vaccination. So again, we came to learn that there's another opportunities which are currently in place. For instance, HIV, TB, all services in primary health care. they are the platform for integration because they use the existing resources which supports the primary intention for these services. Now, when we put the vaccines, then we get much of the secondary benefits. Next. This is my last slide, which speaks about the challenge. As I said, because the integration, when you integrate, you increase number of workload to healthcare workers, but also in our country, it depends. Now, in our country, system, health systems management, it has shortage of staff. So the major challenge of doing integration is the shortage of staff, and those few staffs who are there, they need to integrate, and therefore they are overwhelmed. But also, in the integration where we found the area where the health facilities are too far, so the distance becomes a challenge, and therefore it increases cost for transport, but also other competing activities within the healthcare systems. Thank you very much.
Thank you. Stephanie?
Thank you, Tanuga. We'll go over to Rebecca now.
Thank you very much. And thank you to the two previous speakers. This last presentation brought up so many points that are relevant to some of the things that I'm going to be talking about over the next couple of minutes. Next slide, please. I'm going to be talking about two different subjects, both which represent initiatives that are in process right now. The first is the conduct of a series of country case studies on the extent to which COVID vaccination integration is already happening and where it could go. And the second is the development of a training and planning package specifically for subnational levels on the topic of COVID-19 vaccination integration. Next slide, please. So with regard to the country case studies on COVID-19 vaccination integration, as Laura already described, many countries are already transitioning from the types of service delivery approaches that they initially used in introducing COVID vaccine to something that is more lasting, that really builds COVID vaccination integration into the provision of ongoing services in ways that reach the high priority groups. And we, of course, just heard about this in Tanzania as well. But there is a lot more to be learned on this topic about what is happening, what are we learning that is working well, what isn't working well, and so forth. So with that in mind, USAID is supporting a collaborative effort that is led by two different USAID projects to carry out a series of case studies. The two projects involved are Momentum Routine Immunization Transformation and Equity, an immunization-specific project with which I work, and then the Health System Strengthening Accelerator, which really looks at health system functioning overall. The objectives of the case studies is to generate learning about what has happened thus far with integration, really looking both at what has been working well, what hasn't even been working all that well at this point, and what could be working better. And the second key objective is really to generate considerations and ideas for the future delivery of COVID-19 vaccination in an environment where perhaps the same level of resources that have been available to date for COVID-19 vaccination are not available at that same level. And the intent here, the goal is that the results will be used to assist lower and middle income countries to better identify what they can be doing to support integration of COVID-19 vaccination with other services. Next slide, please. Our overall approach to the case studies tracks closely with the framework that UNICEF has been using in also looking at integration activities for COVID-19 vaccination, looking at the integration mode, such as campaign bundling, routine immunization, integration with other health services, taking into account the target populations, particularly with an emphasis on the high priority groups, taking into account as well the types of service delivery, whether it's through fixed services or through mobile or outreach services. Taking into account the extent to which any kind of integration has already been happening, whether it's a pilot, whether it's phased, whether it's at a broader scale. And then finally, across the bottom, what you can see here is really looking at these dimensions that Laura brought up earlier. I won't go through all of them now. So our protocol is largely organized around the health system building blocks. We are intending to carry out a total of 8 country case studies. 4 will be in person with visits to countries. 4 will be done virtually, and we are expecting to carry them out over the next 3 or 4 months. Next slide, please. Now, we know that many different partners are involved in this whole issue of integrating COVID vaccination into routine immunization and other health services. And for that matter, it is really vital to coordinate across the different groups that are involved. With that in mind, we established a multi-agency advisory group for the country case studies, including representatives from the funder, USAID, as well as CDC, WHO, UNICEF, Gavi, One CSO, and National Immunization Program. And the terms of reference are really about enhancing coordination, providing feedback on the overall approach, sharing complementary documents, reviewing findings from the first country in which we'll do the case study, providing feedback on assessment findings and recommendations, and helping with the dissemination of the products. Next slide, please. At the moment, we are still in discussion with USAID about the countries in which these case studies will be carried out. But what we're really trying to go for is a mix of different country circumstances. So we would like to include countries that have already been innovators in integration, while also recognizing that there is a lot to be learned from countries that have not gotten very far thus far with integration. Certainly, we're looking for geographic diversity. We recognize that it's important to understand the influence of different levels of both COVID-19 vaccination performance and performance for routine immunization. That's part of the context. And certainly we will be working in USAID priority countries and countries where either the Momentum Project or the Health System Strengthening Accelerator Project have a presence and have contacts with people already. Next slide, please. For the in-country visits, we'd expect a visit of about 10 days, conducting interviews with a number of different types of people, certainly with the immunization program, but not just. We also recognize that it's vitally important to talk with people from other priority programs that serve the priority groups. So we need to talk with those working on HIV/AIDS programs, tuberculosis, non-communicable diseases, antenatal care. As well, we want to talk with those working on things like national health insurance authorities, health system development overall, and financing leaders. We also recognize that with COVID vaccination, there have been other parties that have been involved. For example, in some countries, the Prime Minister's office, the presidency, emergency response agencies. We really need to understand what their continued roles will be in looking at integration over the longer term. We'll want to talk with representatives of different priority groups, for example, CSOs and NGOs or groups that have ongoing contact with diabetic patients, older populations, people living with HIV/AIDS. Certainly talking with private providers and managers responsible for COVID vaccination at subnational levels, and of course, immunization partners. We do hope to conduct a field visit in each country to observe what is or is not happening with COVID vaccination, and we'll look to collect and review different key documents and provide a debriefing to share the key findings. Next slide, please. Okay, moving on to the next topic, and this really kind of picks up on what we were just hearing from Tanzania. I really appreciated the top-down and bottom-up approach that was described. MRIGHT is working with WHO to develop a training and planning package on COVID-19 vaccination integration, specifically for subnational levels, for 1 to 2 levels down, say the district level. Now, we recognize that there are many challenges at district and service delivery points for integrating COVID vaccination. And in the interests of time, I'm not going to run through all of these. I think probably most of us are already familiar with these. But a couple of things that came up, particularly in the last presentation, was recognizing that there are important contextual variations across different districts. What might be feasible and appropriate in a densely populated urban area may not be may not be appropriate in a rural area, or in an area where people's economic interests are different, for example. We also recognize that while there is a strong interest in integrating service delivery, you also have to look at the various management functions that support integrated service delivery. And we also want to really make sure that in developing any kind of guidance for a district level, we're very much taking into account what Dr. Florian had mentioned earlier, which is how would integration affect the workload and the responsibilities of those who are responsible for carrying out such integrated efforts, especially if they have not previously been responsible for providing vaccination. Just as Laura talked earlier about people-centered approaches for trying to improve service delivery, we also need to take into account people-centered approaches for understanding the perspectives of the healthcare providers. Next slide, please. So in developing this package for subnational levels on training and planning, we're building on the considerations for integration document that many of you may be familiar with, which Laura mentioned. This includes an excellent checklist, the Annex 3, with several different considerations for countries to take into account. So we will be kind of building off of that and recognizing that whereas decisions about COVID-19 vaccination integration are often made at national levels, the actual implementation and translating those big ideas and decisions into action happens at those subnational levels. Again, I really appreciated the approach that has been taken in Tanzania that we just heard about. So our objective with this training package is to provide practical guidance that enables and supports provincial and district level managers to prepare and support district health personnel in identifying the specific steps and the planning that is needed to integrate COVID-19 vaccination into existing services, recognizing the importance of their own healthcare settings and what may or may not be feasible within those settings. The proposed format is really a facilitator's guide plus a number of tools that can be used during a 2-day workshop for such planning. Next slide, please. And in facilitating this kind of 2-day subnational training and planning workshop, and again, this is all under development right now. We're just in the midst of developing this facilitator's guide. We've come to recognize that there are important steps that need to be taken before the workshop. These include assembling the national policy decisions on COVID vaccination, assembling also information on the different priority groups. How many are there in a given district? Where are they located? What types of resources are available to reach them? And critically, identifying and inviting the appropriate stakeholders, recognizing that this is not business as usual for planning immunization. We really need to reach out and get other people involved. And this is not our typical way of operating in immunization in the past. During the workshop, we'll carry out different, we'll review the national policies so that everybody has an idea of what they are. Then work to develop agreement on context-specific service delivery strategies to reach those high priority groups, and then really work on planning for the changes needed for the management functions that would be essential for bringing about that kind of integrated service delivery. Then we'll work on identifying the resource needs and identifying the next steps, roles, and responsibilities. After the workshop, there is also important work to be done, assessing the feasibility and the impact of proposed changes. In fact, if we can do that during the workshops or even get such information in advance of the workshops, that would really be ideal. It could help inform the decision-making during the workshops. But if not, then certainly that kind of follow-up would be needed. We also see the need to revise existing microplans for immunization, identify and secure the resources needed for implementation, and then adapt or create new materials essential for supporting such integration. And as we heard from Tanzania, again, really ensure that there are mechanisms in place for follow-up monitoring. Next slide, please. So with that, we're now going to go into a couple of poll questions to make this a little bit more interactive and to be able to hear from all of us on this call now. And just in brief, the first two questions will focus on if you were working at district level on COVID-19 vaccination integration, what would you see as the top challenges to successful implementation? And what would you see as the top enablers? And then the third question we will ask in just a moment is, again, at district level, who would you see as the most important people, not just from immunization, but from outside of immunization, to involve for planning for such integration of COVID-19 vaccination? So thank you very much. With this, we'll now go into the poll questions. Next slide, please. And I think, Stephanie, it will be over to Alex. Okay, great. So here is the first poll question. And I think we will have a French translation in the chat box, and Alex may also do that. So let's just take a moment here. We'd like you to select your two top choices of the two top challenges to successful integration of COVID-19 vaccination at district level. So please go ahead, take a moment and make your first your top two choices here. And we'll leave just a minute for this.
Thank you. Merci. Je vais traduire en français pour les francophones. I'm going to translate that into French for those who struggle with English. Si vous travaillez au niveau du district pour intégrer la vaccination COVID-19 dans les soins de santé primaires, quels seraient selon vous les principaux défis à relever pour une mise en œuvre réussie? Veuillez en choisir deux. A, coordination avec d'autres programmes. B, planifier la réorganisation des systèmes pour atteindre les groupes hautement prioritaires. C, impact sur le temps et les responsabilités des agents de santé. D, révision de la chaîne d'approvisionnement et de la gestion des vaccins. E, financement de la révision des systèmes et des processus. F, formation et supervision du personnel de santé. G, révision des outils de collecte et d'utilisation des données. Et H, autres. Veuillez écrire dans le chat.
So I see we're only able to make one choice. Okay, then please, sorry for that. Please do go ahead and make one choice then for the question. Sorry about that.
Désolé, a priori, on ne peut faire qu'un seul choix.
Okay, it looks like we're having a slowdown in participation, so I'm going to close the poll in 10 seconds. Make your choice now. Okay, I'm going to show the results.
Okay, so 30% with option C, impact on health worker time and responsibilities, was the top one, followed by planning service organization to reach high priority populations. Thank you very much. I think we could move on to the next one. So this time we are looking at the enablers. What do you think would be the enablers that would make it possible for such integration to be successful? And please make a single choice here. And Alex, the French option is available in the chat box, is that right?
Yes, so the French version is available in the chat box. La version française est copiée dans le chat. N'hésitez pas à l'utiliser pour faire la référence si vous en avez besoin. Pardon, la version française dans le chat n'est pas la bonne, c'était la question 3. Alors, donnez-moi juste un instant, je vous la remets. La question 2. Voilà, pour la question 2, désolé pour l'erreur.
Thank you very much. Stephanie, are people responding?
People are still responding. We have 63%. Okay, 10 more seconds. And okay, I'm ending it.
Right, so here we see that strong leadership and coordination at district level is viewed as the top priority, followed by effective communication with health workers and clear policies, guidance, and sufficient resources to make changes. Thank you very much. And let's move on to the third question then. So who would be the most important people from outside of immunization to involve in such planning at district level? And let's just take a moment for this as well. And it looks like we just can do one single choice. So this really forces us to prioritize. And I should say that if you have other things that you feel strongly about, other options you feel strongly about, please do write them in the chat box.
La version française de la question 3 est disponible dans le chat si besoin.
Okay, we still have responses coming in. 10 more seconds to get your answers down.
Yes, please. We have just a few minutes left for the Q&A.
Okay, I'm ending the poll now.
And again, if you have other options that you want to mention, please do write them in the chat box. We'd really be very interested to know. Thank you.
Okay, thank you so much to all our participants, and thank you so much for the active chat as well from everybody on the line today. I know we don't have very much time left now for questions and answers, but we do have a few questions that have been posed in the Q&A box and have already been responded to. So, you know, please do check there if your question has already gotten a response. We do have a time for one or two questions though. So I see we have a question from Izatu Sar. And the question is there an integration model to use, such as a reference model, to build the integration framework from, since COVID-19 vaccination has come with some level of hesitancy, thus integrating it into routine immunization that is already accepted by the population may create deeper vaccine hesitancy for those that were already socially approved by communities. So this is a good question. I'm gonna turn it over to Laura to take a first stab at a response, and then we can allow Dr. Chuniga and Rebecca to supplement with any insights that they have. Laura?
Thank you. No, this is a very interesting question, and I think the question around hesitancy and demand comes up a lot when COVID-19 vaccination is mentioned. I suppose the model or the framework would be primary healthcare. And that's, I suppose, the purpose of this talk today. Having a primary healthcare system whereby when new interventions are introduced, that they're available and that, you know, there's sufficient communication and explanation provided, then that should diminish the level of hesitancy. And I think that the acceptance level should go high, because you have this people-centered approach, and you're ensuring that that there's explanations provided. But I do understand that you know, the discussion around hesitancy is very country specific. Even region specific. We see that, you know, the hesitancy issue is very different globally. So it very much depends on your country context. But if there is a level of hesitancy in your country, that should be beared in mind, because I think when it comes to integration in general, and this is something that Rebecca and Dr. Tinwiga can account for, that there's always benefits and risks with integration. And one of the risks with integration is this exact point, that if there is intervention, that there is hesitancy or low acceptance. If you try and integrate with a certain service that has high coverage, then it can interfere with that. But I suppose having this primary healthcare model whereby you have good collaboration across different service sectors, then this should decrease in that hesitancy level. But I'll pass over to Dr. Tinwiga and Rebecca to add on further.
Thank you very much. At my side, I don't have more to respond to the question of integration model. I have my colleagues here from the immunization program. They'd like to talk a bit.
Okay, thank you. I'm Priscilla from IBD, reading Team Read Service Delivery Unit. And we are reading with integrations. As a closing remarks, for integration to be successful, leadership and coordination at all levels is key, and partners engagement, and also availability of resources. Also communications. Okay, thank you. I think those are the key issues, and also political will. And for our country, the leaders are really spearheading the integration approach, so that also we can restore and sustain effort for routine immunization. Thank you.
Thank you very much.
Thank you. Rebecca, do you have any last words to add on?
No, I don't think so. I think those responses were great. I do see we have a couple of other questions in the Q&A. I don't know if we'll have time to get to them.
I don't think we have enough time because we're at 4 now and our interpreter is leaving us, but hopefully your questions have been addressed in the chat. For those who raised them, there are answers there. Just one quick one about the interactions of COVID-19 with other vaccines co-administered. Laura's provided links there for any further reference, but if anybody has any questions about that, then definitely do reach out. I just wanted to remind everybody that we have another webinar scheduled in this series next month on the 10th of May. That's going to cover using school platforms for an opportunity for vaccination status checks and catch-up vaccination. If you've been registered today, you should automatically be registered for that one. So look out in your inbox, but of course, do continue to share the links and poster for these webinar series with your colleagues widely and encourage them to join. We will continue to have webinars once a month throughout the rest of the year on new and exciting topics around life course and integration. So hope to see you all at a future webinar. And thank you again to our panelists today and to our TechNet hosts and for everyone's participation on the call.
Thank you very much, Stephanie. So we can close this session. Thank you very much, everyone. We'll send everything by email, all the materials, and we hope to see you guys on Wednesday, the 10th of May. Thank you, and have a great rest of the day.
Thank you, Asante.
Thank you.